Hey, I'm Tamara Kendacker, and you're listening to the Decibel from the Globe and Mail. So on Monday, across the country, we saw the latest round of protests against COVID health measures like vaccine mandates and vaccine passports. The turnout in any one place paled in comparison to, say, the protests earlier this month at Vancouver General Hospital, where there were reports of patients struggling to get into the hospital as protesters surrounded the building, people hurling verbal abuse against staff as they came and left work, and a physical assault against a healthcare worker. There were concerns that Monday's protests would be similar. It even got some attention on the federal election campaign trail, with party leaders speaking out to condemn anyone who planned on stopping hospital workers from doing their jobs or patients from accessing care.
These protests, this harassment of our frontline nurses, doctors, is completely unacceptable.
Do not risk the lives of patients. Do not impede the work of healthcare workers.
It is not okay that across the country, hospitals are having to put up barricades today to manage the mobs coming their way.
On Tuesday, I talked to my colleague Andrea Woo, who covered the protest in Vancouver on Monday, and she's on the show.
The fact that these people are in front of hospitals, demoralizing healthcare workers who have been working the last 18 months to save people, to protect the very people who are protesting them, has been very demoralizing.
We're going to talk about who's behind these demonstrations, how they're impacting healthcare workers, and what, if anything, can actually be done about them. You're listening to The Decibel. Hi, Andrea. Thanks so much for joining us.
Thank you so much for having me.
So let's start with the protest that you covered on Monday in Vancouver. What did it look like?
So there are a number of protests planned across the country this week in opposition to COVID-19 measures, such as vaccine passports, the restriction of movement, and mandatory masking policies. So there were 18 planned across the country yesterday, and I was at the one at Vancouver City Hall. It was relatively small. There were about 200 people chanting, speakers. Speakers told the crowd to stand up for their freedoms. They gave advice on what to do should a security guard try to enforce a mask mandate or a vaccination requirement.
So this one with 200 people was, I guess, much smaller than anticipated.
Yeah, and it was about the same at other locations across the country, too. There was one in front of Toronto General Hospital. There was 100-something people.
Mm-hmm. How would you describe the crowd of people? Like, who were they?
They were angry. I mean, the people who are attending these protests are a lot more passionate in their opposition to these measures. So we had people holding up signs that said, violent things against Justin Trudeau. Mm-hmm. And, the fact that people are comparing vaccination requirements to the Holocaust, I think that tells you about the type of person who is at these protests.
Yeah. And did you speak with any of them?
Yeah.
How did that go?
There was one woman who saw me taking notes and she asked what I was doing, and I said, I'm a reporter. And she said she would be up for talking and please don't make her sound dumb. Mm-hmm. And she said she wanted to have a thoughtful conversation about this. We're not all just anti-vaxxers. But as we spoke, she talked about how not that many people are dying from COVID. And is it truly a pandemic? And maybe if a third of the population died, then that's something that's worth restricting our freedoms for. But right now, it's not that serious. There was another gentleman that I talked to who called me a liar, said, media is at fault here, that everything we're seeing about hospitals and critical care being at capacity is a lie, and that this is all somewhat propagated by media.
Right. So they're against vaccine passports, vaccine mandates. And I guess that's why they're protesting now, because all of these things are coming into effect across the country.
Yeah, and there's a mishmash of reasons and things that they are opposed to, but this also coincided with the first day in British Columbia where we have implemented the BC vaccine card. So you need to show proof of vaccination to enter non-essential businesses like restaurants and pubs and concerts, etc. So that was a part of it too.
Mm-hmm. Do we have any idea who organized these protests? What do we know about them?
An organization called Canadian Frontline Nurses ostensibly has been the organizer of these national hospital protests. They have their logo on flyers. From the names that we've seen associated with the organization, it appears to be made up of just a handful of people, including some fired and former nurses. Mm-hmm. It's been widely denounced by several healthcare associations, including the Registered Nurses Association of Ontario, the Ontario Medical Association, and the Canadian Nursing Association. And aside from that, there are Facebook groups and other chats on platforms such as Telegram where people are organizing these protests.
Yeah, and why do the people who organize the protests, how do they justify the protesting at hospitals? Like, many people have pointed out that that's not where these policies are even made.
Yeah, some of the recent comments that I've been reading in these chats, there are members who say hospitals are the place to do this because there are healthcare workers who are opposed to some of these restrictions. And I think the thinking is that by having an organization like Canadian Frontline Nurses organizing this, it lends an air of credibility. But when you look through some of these chats among participants and people who are opposed to the restrictions, it is quite mixed. And there are people saying that protesting in front of a hospital makes them look bad. And they're aware that sending medics home in tears is not necessarily the best strategy for public support. But the fact that these protests, while they may not be large in size, the fact that these people are in front of hospitals, demoralizing healthcare workers who have been working the last 18 months to save people, to protect the very people who are protesting them, has been very demoralizing.
Did you speak to any other doctors, and what did they say about how they feel watching these protests?
There is a large staffing issue in many hospitals right now from people who are beyond burnt out over the past 18 months. We've talked to dozens of healthcare workers, and I'd say almost all that we have talked to are frustrated. Some are very angry. I spoke with one critical care doctor in Edmonton who late Sunday night got a visit from police officers who said there'd been a credible threat against his life. And he's someone who has been very active on social media throughout the entire pandemic, talking about the realities of what he is seeing in ICU, what we need to be doing. Police told him there's a credible threat and essentially, watch your back, take care. And so he was very unnerved. And the following day, one of these protests was at his hospital. The turnout there was also quite small, a couple of hundred people, but he had a security detail with him and he stayed in his office the entire time.
Wow. And so this was in Edmonton, where Alberta and Saskatchewan, I think, are experiencing a really bad fourth wave, right? Can you just give me a sense of what's going on there in those hospitals right now?
Yeah, Western Canada is particularly hard hit right now. Alberta and Saskatchewan have the highest per capita rates of COVID-19 transmission and hospitalization. Alberta right now has 209 people in critical care, which is more than at any other time during the pandemic. Normally, Alberta maintains 173 critical care beds. Saskatchewan on Monday recorded the highest single day count of new infections and has about 209 people in hospital, which I believe is also a pandemic high for the province, and if not, then very close to it. And that includes 41 people who are in critical care right now. In both of those provinces, what this has meant is that thousands of scheduled surgeries have been canceled to make room and to make available healthcare workers and equipment for COVID-19 patients. And scheduled surgeries, elective surgeries, I mean, these are very serious surgeries. These are some cancer surgeries, for example, that people have been waiting for months or sometimes years that are now being canceled because our hospitals are full.
And these people who we're seeing end up in hospital, do we know who they are and are they vaccinated or who are they?
So the thing that has really frustrated a lot of these very healthcare workers is that they are treating overwhelmingly people who are unvaccinated. So there are differences in data access across province, but as an example, here in BC, where I am, people who are unvaccinated or partially vaccinated currently account for about 86% of COVID-19 patients in hospital and 93% of people in critical care.
Wow.
In Alberta, people who are unvaccinated or partially vaccinated make up about 75% of people in hospital, excluding critical care, and about 90% of people in critical care. But a more useful way to look at it might be the most recent data from PHAC, the Public Health Agency of Canada, which is that new cases among unvaccinated people were 12 times higher than in the fully vaccinated, and hospitalized cases among unvaccinated people were 36 times higher than in the fully vaccinated. So these are the people that these healthcare workers are treating right now while watching these protests.
We've been seeing a lot of coverage of these demonstrations, but I wonder if you can kind of put this all into context for us, not just Monday's protests, but the ones that we've seen over the last few weeks. Is this a lot of people or is it a small vocal minority?
It is a small vocal minority, and I think we can tell that by the fact that Canada has 85% of its population vaccinated. We are one of the most protected countries out there right now. And also, to be fair, there are people with very legitimate concerns about these measures. For example, in British Columbia with our vaccination program, the province is offering no exemptions for medical or religious purposes. And some say that some say that there could be a valid legal argument there. But the people who sort of have some thoughtful concerns are not the people showing up at these protests and blocking hospital access and comparing it to the Holocaust.
Yeah, so maybe some of those legitimate concerns are being drowned out by these much louder, fringe voices.
Right.
So I know the three major party leaders all made statements about the protests, I think in advance of when they were happening. So can you tell me what they said?
So at campaign stops this week, both Liberal leader Justin Trudeau and NDP leader Jagmeet Singh said they would make it a criminal offense to obstruct access to healthcare facilities such as hospitals, clinics, and pharmacies. Mr. Trudeau added that the Liberal Party of Canada would also make it a criminal offense to harass healthcare workers carrying out their professional duties, while Mr. Singh said threatening a healthcare worker or patient would be an aggravating factor in sentencing. Conservative leader Erin O'Toole similarly condemned these hospital protests and called them completely unacceptable, but he said he had great faith in law enforcement officials to ensure that access to healthcare would be unimpeded.
Yeah, and I know you talked to some legal experts about this idea of making it illegal to protest in front of a hospital, and what did they tell you?
Yeah, so we spoke with legal and civil liberties experts who said that all of the problematic behavior that the leaders are targeting here is essentially already covered by existing law. So, for example, mischief covers interfering with someone's lawful access to property. There are criminal harassment and nuisance provisions and trespass laws if you resist leaving a private property like a hospital. What I thought was very notable was Kara Decibel, director of the Fundamental Freedoms Program at the Canadian Civil Liberties Association. She also raised the point that many of the things that we are seeing at these protests, for example, shouting insults and spreading misinformation, while they're undoubtedly abhorrent, they're not illegal. And she urged caution against instinctually creating new laws as a response to every problem that we have.
Mm-hmm. And so if there are already rules to prevent the kind of behavior that the leaders are talking about, I'm curious why we haven't seen police be more hands-on about this, and why haven't we seen the police do something when they're, trying to block ambulances and stuff like that?
That is an excellent question. And we have seen the differences in police response to protests, the stark difference over the past year. I mean, when you look at Fairy Creek, when you look at homeless encampments, there's a very prepared response in advance of the event. Whereas with the hospital protest at Vancouver General Hospital, it was reactive.
Right.
So at some of these Indigenous-led protests, there is already a militarized police force at the ready, whereas at the hospital, a protest that was expected to be a couple of hundred people ended up being thousands, and we didn't see anywhere close to the same police response.
Yeah.
And so I think that is a question for the authorities.
Yeah, and did you by any chance ask Vancouver police about this? Have they said anything about that?
They have issued a statement saying that they respect the rights of peaceful protest, that there have been 500-something protests in the city this year, and they're there to keep the peace. But there is not a lot of explanation about the disparities that we see in response.
So where do you see all of this going? Because it seems like the turnout yesterday wasn't as high as expected. So is there any chance you think that these protests will just die down soon and people will get over it?
I would expect that there would be continued protests, especially as we phase in further restrictions. For example, in Ontario, we have the vaccination requirements coming into effect next week.
Already, we are seeing the impact, with over 90,000 first doses administered in the week following our announcement to require proof of vaccination, an increase of 29% from the previous week. To ensure
in British Columbia, by the middle of October, we will need people to be fully vaccinated to access anything.
Let's focus on making sure we get those numbers up from 85% to 90% and beyond, and we do that by focusing on all of the benefits that the BC vaccine card can bring to British Columbia. And with that, I'll ask Dr. Henry.
And so I don't anticipate that this will be going away anytime very soon.
Okay, Andrea, thank you so much.
Thank you for having me on.
All right, that's it for today. I'm Tamara Kandakar. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thank you so much to Andrea Woo. You can find her on Twitter at Andrea Woo. If you want to email us, you can reach us at thedecibel@globeandmail.com. If you want to reach me, I'm on Twitter at Anima_TK. If you haven't already, hit that follow button wherever you're listening to this so you never miss an episode. Thank you so much for listening, and I'll talk to you tomorrow.